The White House was lit in pink last night in honor of breast cancer awareness. October is Breast Cancer Awareness Month, and developing a vaccine to treat cancer is really a complicated process. We want to bring in 9 Health expert Dr. Payal Kohli to join us and talk about vaccines for cancer prevention. I can't imagine, what a difficult process that is, but how life-changing it would be. I mean, is this a concept that could come to fruition soon?
It could be game-changing, as you said, and in fact, we're already using vaccines in cancer therapy. So if you think about cervical cancer, which is caused by a virus, human papillomavirus, it's easy to make a vaccine for a cancer that's caused by a virus. When it comes to breast cancer, lung cancer, esophageal cancer, these are solid cancers not caused by viruses, sometimes caused by genetics. So here the idea is to use our immune system, train our immune system how to recognize cancer cells so that the first sign of a cancer cell, whether it's microscopic or teeny tiny, the immune system can kind of go to war and attack it.
Is this stopping breast cancer from being detected at all or happening at all? Or can you stop it from being recurring?
Both. And this is what's really exciting. We're thinking of it as a treatment and as a prevention. So at the Cleveland Clinic, they're actually doing a trial right now for what's called triple negative breast cancer, which is the worst kind of breast cancer because it has no markers on it that you can target. It's one of the most deadliest breast cancers. So what they're using is a marker on the cancer cell that's a milk protein that usually only gets expressed when you're breastfeeding, but cancer cells also have it, and training your immune system to recognize that marker and attack it. And then at the Mayo Clinic, they're actually looking at microscopic cancer, which is called ductal carcinoma in situ, before it's even spread. It just shows up on a mammogram, and attacking that. And then at Penn, which is the latest study, they're looking at women who are BRCA positive, who have not developed breast cancer, who previously the only options we had were a mastectomy or oophorectomy, take out their ovaries, take out their breasts. Really not much we can do except screen them more aggressively. But here's tricking the immune system.
Interesting. You talk about screening for the BRCA gene, which, I mean, you talk about like the advances that we've had in the last, decade. It really is incredible, and this would be another step. Is there a vaccine to look at that as well for those of us who are more high risk?
Yes, and so the idea is to start studying this vaccine in the BRCA positive patients because those are the ones with the flag on their head, right? Mm-hmm. Their genetics are priming them to have breast cancer. But eventually, Alex, I'm hoping that this means that they're going to bring it into the general population. So we start with the higher risk patients, and then once we've established that the vaccine is safe and effective, why not give it to all women? And imagine that if you could actually go and get a vaccine that could reduce your chance of getting breast cancer that's safe and well tolerated. Yes, exactly.
I know I'm conflating two things. People are going to be like, well, we just got that COVID vaccine right away. What's the problem in coming up with these vaccines that are clearly more complicated?
Yes, so many problems. The first is the timing, right? We just talked a little bit about who should we give it to, the people that are recurring, to prevent it, or both. The second is how many vaccines do you give? How often do you sort of rev up that immune system, and how do you do it? The third is one of the challenges we had with the COVID vaccine. What part of the cancer cell should we target? Should we target the protein, which is actually sticking out, or should we go upstream to the RNA, like the COVID vaccines did, or to the DNA, which is where the real problem is with the cancer cell? And then finally, cancer cells have this amazing ability to put up a force field around them that prevents our immune system from seeing them. So the idea is whether we should give something that puts down that force field along with the vaccine. These are called immune checkpoint inhibitors to kind of put down the cancer cell's guard and then teach the immune system how to find it.
It sounds incredible. Is this something that's going to happen in our generation, or are we just like a few years out? What's the timeline on this?
So I'm very optimistic, certainly for our generation and our next generation, but we're thinking at the earliest about 5 years because it's in early phase clinical trials, and more realistically, maybe 7 to 10. But certainly within the next few years, we're going to see this change, which is incredibly exciting.
I like the force field idea. Let's work on getting down the force field.
That's right. Yeah.
That seems simple.
Yeah.
Simple enough. Dr. Kohli, thank you. As always, we appreciate you.